নমস্কার, ইউটিউবের পরিবারের সবাইকে স্বাগত জানাই। JEPBN এবং JEMScN পোস্ট বেসিক বিএসসি নার্সিং এবং এমএসসি নার্সিং এন্ট্রান্স এক্সামের ফাইনাল অ্যান্সার কি গতকাল সন্ধ্যেবেলাতে পাবলিশ হয়ে গেছে এবং আজ রেজাল্ট আউট হবে। আজ থেকে র্যাঙ্ক কার্ড ডাউনলোড করা যাবে এবং র্যাঙ্ক কার্ডের মধ্যে স্কোর এবং র্যাঙ্ক দুটোই দেওয়া থাকবে। ওয়েবসাইটের লিঙ্ক আমি আপনাদের ডেসক্রিপশন বক্সে দিয়ে দেবো, আপনারা সেখান থেকে পেয়ে যাবেন। এবং আপনারা এখানে এক্সামিনেশনের অপশন রয়েছে, এখানে JEMScN-এ গেলে আপনারা এখান থেকে আপনারা ফাইনাল অ্যান্সার কি পেয়ে যাবেন। নোটিস রিগার্ডিং ফাইনাল অ্যান্সার কি JEMScN 2024 এবং রেজাল্ট আজ যে আউট হবে সেই রেজাল্টের একটি নোটিশ রয়েছে। সেম একইভাবে আপনারা JEPBN-এ গেলে এখানে একটি নোটিশ রয়েছে, রেজাল্ট নোটিশ অফ JEPBN 2024। আজ 21 আগস্ট, আজ থেকে র্যাঙ্ক কার্ড ডাউনলোড করা যাবে এবং র্যাঙ্ক কার্ড ডাউনলোড করার জন্য এখানে দুটি ওয়েবসাইটের লিঙ্ক দেওয়া রয়েছে। JEPBN-এ নিউজ অ্যান্ড নোটিশে আরেকটি অপশন রয়েছে, নোটিস রিগার্ডিং ফাইনাল অ্যান্সার কি JEPBN 2024। এই অপশনে ক্লিক করলে JEPBN 2024 পোস্ট বেসিক বিএসসি নার্সিং এন্ট্রান্স এক্সামের ফাইনাল অ্যান্সার কি এখানে দেওয়া রয়েছে। প্রথমে মডেল অ্যান্সার কি পাবলিশ হয়েছিল, মডেল অ্যান্সার কি পাবলিশ হওয়ার পরে কিছু কোশ্চেন চ্যালেঞ্জ হয়েছে এবং চ্যালেঞ্জ হওয়ার পরে ফাইনাল অ্যান্সার কি পাবলিশ হয়েছে। এখানে সেটের সিম্বল দেওয়া রয়েছে 4টি সেট অনুযায়ী এবং সেই অনুযায়ী এখানে কিন্তু ফাইনাল অ্যান্সার দেওয়া রয়েছে। 4টি সেটের এখানে কোশ্চেন নাম্বার দেওয়া রয়েছে এবং ফাইনাল অ্যান্সার কি দেওয়া রয়েছে। বোর্ডের তরফ থেকে একটি কোশ্চেনের অ্যান্সার উইথড্র করা হয়েছে এবং মডেল অ্যান্সার কিতে একটি কোশ্চেনের অপশন যা ছিল, অ্যান্সার যেটা ছিল, ফাইনাল অ্যান্সার কিতে সেই কোশ্চেনের অ্যান্সার কিন্তু চেঞ্জ হয়েছে, অপশন চেঞ্জ হয়েছে। সেটা আপনাদের যখন কোশ্চেন অ্যান্সার আলোচনা করব তখন আপনাদের বলে দিচ্ছি। এবং এখানে টোটাল 100টি কোশ্চেন রয়েছে এবং 100টি কোশ্চেনের অ্যান্সার কি হবে, ফাইনাল অ্যান্সার কি এখানে দেওয়া রয়েছে। এবং এখানে বলাও রয়েছে W means the question is withdrawn, hence marks will be awarded to all appear candidate। বোর্ডের তরফ থেকে একটি কোশ্চেন উইথড্র হয়েছে এবং সেই কোশ্চেনের মার্কস সবাই পেয়ে যাবেন। ফাইনাল অ্যান্সার কি অনুযায়ী JEPBN 2024-এর 100টি কোশ্চেনের অ্যান্সার কি হবে চলুন দেখে নেওয়া যাক। এই সেটটি হলো সেট ডি। ফার্স্ট কোশ্চেন, patient believe that the nurse and doctor are talking about him. This could best be described as option A obsession, option B delusion of reference, option C delusion of persecution, option D an idea of influence. Answer option B delusion of reference. Next question, nurse can minimize agitation in a disturbed client by option A increasing stimulation, option B limiting unnecessary interaction, option C increasing appropriate sensory perception, option D ensuring constant client and staff contact. Answer option B limiting unnecessary interaction. Next question, in schizophrenia, the term anhedonia refers to option A an inability to enjoy food, option B an inability to express empathy, option C an inability to react to enjoyable or pleasurable events, option D an inability to react appropriately to social cues. Answer option C an inability to react to enjoyable or pleasurable event. Next question, the 4A's schizophrenia are option A anxiety, ambivalence, autism, affective disturbance, option B amnesia, ambivalence, autism, affective disturbance, option C autism, affective disturbance, anxiety, amnesia, option D autism, ambivalence, affective disturbance, associative disturbance. Answer option D. Next question, FLACC scale is used to assess which of the following parameter in children. Option A pain, option B dehydration, option C anxiety, option D consciousness. Answer option A pain. FLACC স্কেল হলো ফেস লেগ অ্যাক্টিভিটি ক্রাই কনসোলেবিলিটি স্কেল, পেন রেটিং স্কেল এক ধরনের। নেক্সট কোশ্চেন, আন্ডার পোষণ অভিযান দ্য ফোকাস ইজ অন অপশন এ হেলথ অ্যান্ড নিউট্রিশন, অপশন বি এডুকেশন, অপশন সি ভ্যাকসিন প্রমোশন, অপশন ডি আর্লি ট্রিটমেন্ট অ্যান্ড রেফারেল। অ্যান্সার অপশন এ হেলথ অ্যান্ড নিউট্রিশন। নেক্সট কোশ্চেন, an example of non-therapeutic communication technique is option A validating, option B belittling, option C reflecting, option D listening. Answer option B. Question number 8, benzodiazepine reduce anxiety by acting on which neurotransmitter? Option A GABA, option B serotonin, option C noradrenaline, option D dopamine. Answer option A GABA. Question number 9, a mental disorder characterized by stereotype speech is option A mannerism, option B cataplexy, option C verbigeration, option D negativism. Answer option C verbigeration. Next question, question number 10, seminoma testis. Question number 10. Seminoma testis is a option A germ cell tumor, option B vascular tumor, option C mesothelial tumor, option D epithelial tumor. Answer option A germ cell tumor. Question number 11. Cobweb formation in the CSF is characteristically seen in option A tubercular meningitis, option B pyrogenic meningitis, option C astrocytoma, option D meningioma. Answer option A tubercular meningitis. Question number 12. The nurse is assigned to a client with catatonic schizophrenia. Which intervention should the nurse include in the client's plan of care? Option A giving the client an opportunity to express concern, option B maintaining safe distance from the patient, option C administering lithium carbonate as prescribed, option D providing a quiet environment where the client can be alone. Answer option A giving the client an opportunity to express concern. Question number 13. The nurse is caring for a client who experiences false sensory perceptions with no basis in reality. These perceptions are known as option A delusion, option B hallucination, option C loose association, option D neologism. Answer option B hallucination. Next question. Which of the following is a major side effect of typical antipsychotics? Option A tardive dyskinesia, option B thyroid abnormality, option C weight gain, option D headache. Answer option A tardive dyskinesia. Question number 15. The drug of choice for ventricular tachycardia is option A digoxin, option B Zylocart, option C propranolol, option D pethidine. Answer option B Zylocart. Question number 16. The main adverse effect of salbutamol are option A bradycardia and heart block, option B palpitation and muscle tremor, option C nausea and vomiting, option D diarrhea and hypotension. Answer option B palpitation and muscle tremor. Question number 17. The commonest cause of fatty liver is option A starvation, option B alcoholism, option C steroid, option D carbon tetrachloride. Answer option B alcoholism. Question number 18. Major mechanism of transport of drug across biological membranes is by option A passive diffusion, option B facilitated diffusion, option C active transport, option D endocytosis. Answer option A passive diffusion. Next question. Question number 19. Drug of choice for myoclonic seizure. Option A vigabatrin, option B phenytoin, option C valproate, option D carbamazepine. Answer option C valproate. Question number 20. Prolonged infection with HPV-18 is linked with option A ovarian cancer, option B carcinoma of the cervix, option C endometrial cancer, option D uterine polyps. Answer option B carcinoma of the cervix. Question number 21. Which drug does not cross the placental barrier? Option A diazepam, option B heparin, option C pethidine, option D decumeryl. Answer option B heparin. Question number 22. The drug chloroquine act on the option A blood seasons, option B merozoites, option C gametocytes, option D tissue seasons. Answer option A blood seasons. Question number 23. All of the following hormones are secreted by anterior pituitary except option A growth hormone, option B oxytocin, option C prolactin, option D gonadotropin. Answer option B oxytocin. Question number 24. Broca's area is located in which lobe? Option A parietal, option B frontal, option C temporal, option D occipital. Answer option B frontal. Question number 25. CSF is secreted by option A hypothalamus, option B pineal body, option C choroid plexus, option D medulla oblongata. Answer option C choroid plexus. Question number 26. Hematocrit value is the ratio of option A WBC to plasma, option B platelet to plasma, option C RBC to plasma, option D total blood cell to plasma. Answer option C RBC to plasma. Question number 27. Which of the following hormone helps in the secretion of HCl from stomach? Option A gastrin, option B secretin, option C pepsin, option D renin. Answer option A gastrin. Question number 28. During normal breathing, the amount of air that moves into the lungs and comes out is called option A inspiratory reserve volume, option B residual volume, option C expiratory reserve volume, option D tidal volume. Answer option D tidal volume. Question number 29. The end product in the process of blood coagulation is option A fibrin, option B thrombin, option C thromboplastin, option D prothrombin. Answer option A fibrin. Question number 30. Renin is a hormone secreted by the option A pancreas, option B kidney, option C liver, option D ovary. Answer option B kidney. Question number 31. The nurse asks the client to read the Snellen chart. Which of the nerve function is tested? Option A optic, option B olfactory, option C oculomotor, option D cochlear. Option A optic. Question number 32. Which of the following is a plasma volume expander? Option A normal saline, option B Hemaxil, option C ringal lactate, option D dextrose normal saline. Answer option B Hemaxil. Question number 33. Final stage of grief is option A bargaining, option B denial, option C acceptance, option D depression. Answer option C acceptance. Question number 34. Solution with higher osmotic pressure that pulls fluid from cell is option A isotonic, option B hypotonic, option C hypertonic, option D oncotic. Answer option C hypertonic. Question number 35. Crackling sounds bilaterally at the base of lungs is referred to as option A rhonchi, option B wheezing, option C rales, option D pleural rap. Answer option C rales. Question number 36. Which part of the human brain is primarily responsible for regulating heart rate, blood pressure and respiration? Option A cerebrum, option B cerebellum, option C brainstem, option D hippocampus. Answer option C brainstem. Question number 37. Which of the following terms describe the body's ability to maintain its normal state? Option A anabolism, option B catabolism, option C tolerance, option D homeostasis. Answer option D homeostasis. Question number 38. In triage, yellow color indicate option A emergency, option B urgent, option C non-urgent, option D dead. Answer option B urgent. Question number 39. Client had positive Trousseau sign. Which electrolyte imbalance can be expected? Option A potassium, option B calcium, option C sodium, option D magnesium. Answer option B calcium. Question number 40. Godel sign indicate option A bluish discoloration of the vaginal wall, option B regular rhythmic uterine contraction, option C opening of the cervix, option D enlargement of the uterus. Answer option C opening of the cervix. Question number 41. Fundus of the pregnant uterus is palpable at 40 weeks of gestation. Option A at the level of 32 weeks, option B at the level of episternum, option C at the level of umbilicus, option D at the level of symphysis pubis. Answer option A at the level of 32 weeks. Question number 42. Which type of pregnancy sign is quickening? Option A probable sign, option B presumptive sign, option C positive sign, option D directional sign. Answer option B presumptive sign. Question number 43. Positive Babinski sign is option A abnormal for adult, option B abnormal for children, option C abnormal for all age group, option D abnormal for neonate. Answer option A abnormal for adult. Question number 44. What information does anecdotal record contain? Option A record of some observation about a person, option B record of number of patient in the ward, option C record of date, option D making statement of judgment. Answer option A record of some observation about a person. Question number 45. What can be assessed by Romberg test? Option A hearing ability of a person, option B visual acuity of a person, option C balance of a person, option D joint movements of a person. Answer option C balance of a person. Question number 46. Carcinoma of cervix in stage 1. Option A carcinoma is strictly confined to cervix, option B carcinoma spread beyond the cervix, option C carcinoma spread beyond the uterus, option D carcinoma spread in abdomen. Answer option A carcinoma is strictly confined to cervix. Question number 47. Narrowest part of the fallopian tube is the option A interstitial portion, option B isthmus, option C infundibulum, option D ampulla. Answer option A interstitial portion. Question number 48. type of placenta previa in which placenta completely covers the internal os is known as option A marginal placenta previa, option B low lying placenta previa, option C central placenta previa, option D partial placenta previa. Answer option C central placenta previa. Question number 49. The immunoglobulin that cross the placenta barrier, option A IgM, option B IgG, option C calcium, option D IgA. Answer option B IgG. Question number 50. The family which one set up after marriage is termed as option A extended family, option B nuclear family, option C family of origin, option D family of procreation. Answer option D family of procreation. Question number 51. The single most important hormone for maintenance of effective and continuous lactation, option A oxytocin, option B estrogen, option C prolactin, option D progesterone. Answer option C prolactin. Question number 52. The dose of anti-D immunoglobulin for a Rh negative mother after the birth of the baby. Option A 50 microgram, option B 100 microgram, option C 200 microgram, option D 300 microgram. Answer option D 300 microgram. Question number 53. Umbilical cord is attached to the edge of the placenta is called option A velamentous insertion, option B placenta succenturiata, option C battledore placenta, option D placenta incluata. Answer option C battledore placenta. Question number 54. The scientific study of human population is termed as option A census, option B demography, option C vital statistics, option D survey. Answer option B demography. Question number 55. A nurse would advise the patient to avoid salt substitute and foods such as banana, tomato and orange juice for the following disorder. Option A hyperkalemia, option B hypokalemia, option C hypomagnesemia, option D metabolic acidosis. Answer option A hyperkalemia. Question number 56. Absence of the following clotting factor leads to hemophilia A. Option A factor 7, option B factor 8, option C factor 9, option D factor 10. Answer option B factor 8. Question number 57. A client weighing 76 kg is admitted in emergency department with 40% burn. Using Parkland formula, client's 24 hours IV fluid replacement should be option A 6080 ml, option B 9120 ml, option C 12160 ml, option D 15180 ml. Answer option C 12160 ml. Question number 58. The purpose of maintaining NPO for 6 to 8 hours before surgery is option A to prevent vomiting, option B to prevent electrolyte imbalance, option C to prevent pulmonary aspiration, option D to prevent urination. Answer option C to prevent pulmonary aspiration. Question number 59. Practice that have been repeated by a multitude of generation practice is refers to option A law, option B habits, option C custom, option D culture. এই কোশ্চেনের অ্যান্সার মডেল অ্যান্সার কিতে অ্যান্সার ছিল কালচার, তবে ফাইনাল অ্যান্সার কি অনুযায়ী অ্যান্সার হবে কাস্টম। Question number 60. In India, the most rigid system stratification is option A class, option B caste, option C state, option D slavery. Answer option B caste. Question number 61. Social change referred to option A change in individual value, option B change in the value of the society, option C change in technology, option D change in census. Answer option B change in the value of the society. Question number 62. Silver nitrate dressing may cause option A increased creatinine level, option B depletion of sodium and potassium, option C increased blood urea nitrogen, option D increased potassium level. Answer option B depletion of sodium and potassium. Question number 63. Sign and symptom of digoxin toxicity. Option A convulsion, option B vertigo, option C yellow vision, option D muscle cramp. Answer option C yellow vision. Question number 64. Diabetes insipidus is caused by the deficiency of option A antidiuretic hormone, option B insulin, option C glucagon, option D renin. Answer option A antidiuretic hormone. Question number 65. According to Piaget, Egocentrism is the features of which of the cognitive development? Option A, concrete operational. Option B, pre-operational. Option C, formal operational stage. Option D, sensory motor stage. Answer option B, pre-operational stage. Question number 66. In which of the following type fracture the bone is shattered into numerous fragments? Option A, green stick fracture. Option B, avulsion fracture. Option C, comminuted fracture. Option D, displaced fracture. Answer option C, comminuted fracture. Question number 67. Immediate treatment of dog bite. Option A, hospitalization. Option B, application of antiseptic. Option C, wash the wound with soap and water. Option D, suturing. Answer option C, wash the wound with soap and water. Question number 68. Which of the following is a screening test for balance? Option A, Raines test. Option B, Weber test. Option C, Allen test. Option D, Romberg test. Answer option D, Romberg test. Question number 69. Another term for reinforcement is option A, stimulus. Option B, reward. Option C, response. Option D, condition. Answer option B, reward. Question number 70. In metabolic process, vitamin D is absorbed in option A, stomach. Option B, small intestine. Option C, large intestine. Option D, start from the stomach and end in large intestine. Answer option B, small intestine. Question number 71. To prevent neural tube defect in a baby, which nutrient is given as supplementation for the mother during pregnancy? Option A, calcium. Option B, iron. Option C, folic acid. Option D, magnesium. Answer option C, folic acid. Question number 72. Which is also known as the accessory dietary factor? Option A, fat. Option B, vitamin. Option C, protein. Option D, hormone. Answer option B, vitamins. Question number 73. Index of duration of malnutrition is option A, weight for height. Option B, height for age. Option C, weight for age. Option D, none. Answer option B, height for age. Question number 74. The ability to tolerate frustration is an example of one of the function of the option A, id. Option B, ego. Option C, superego. Option D, unconscious. Answer option B, ego. Question number 75. Another term for superego is option A, self. Option B, ideal self. Option C, narcissism. Option D, conscience. Answer option D, conscience. Question number 76. Specific abilities are measured by option A, achievement test. Option B, aptitude test. Option C, intelligence test. Option D, occupational test. Answer option B, aptitude test. Next question. Question number 77. IPV is a dash injectable vaccine. Option A, killed. Option B, live attenuated. Option C, inactivated. Option D, toxoid. এই কোশ্চেনটি বোর্ডের তরফ থেকে উইথড্র করা হয়েছে। এই কোশ্চেনের মার্কস সবাই পেয়ে যাবেন। Question number 78. Ophthalmia neonatorum in newborn is caused by option Neisseria gonorrhea. Option B, Neisseria meningitis. Option C, Haemophilus influenza. Option D, Streptococcus pneumonia. Answer option A, Neisseria gonorrhea. Question number 79. Dash mediate type 1 hypersensitivity reaction. Option A, IgA. Option B, IgD. Option C, IgE. Option D, IgG. Answer option C, IgE. Question number 80. In the natural history of disease, the pathogenesis phase is deemed to start upon option A, entry of the disease agent in the human host. Option B, interaction between agent host and environment factor. Option C, appearance of sign and symptom. Option D, appearance of complication. Answer option A, entry of the disease agent in the human host. Question number 81. Morbidity in a community can best be estimated by option A, active surveillance. Option B, sentinel surveillance. Option C, passive surveillance. Option D, monitoring. Answer option A, active surveillance. Question number 82. The response to iron replacement therapy is indicated by an increase in hemoglobin at the rate of option A, 2 gram per week. Option B, 1 gram per week. Option C, 1 gram per month. Option D, 2 gram per month. Answer option B, 1 gram per week. Question number 83. The ability of a class of microbe to produce disease is referred as option A, virulence. Option B, pathogenicity. Option C, commensals. Option D, infection. Answer option B, pathogenicity. Question number 84. Coptic spot on the buccal mucosa is a characteristic features of option A mumps, option B measles, option C rubella, option D respiratory syncytial virus. Answer option B measles. Question number 85. VIA or visual inspection with acetic acid is a method of screening for cancer of option A oral cavity, option B cervix, option C gastric, option D prostate. Answer option B cervix. Question number 86. Which of the following center are now known as Health and Wellness Center? Option A CHC, option B district hospital, option C sub-center, option D rural hospital. Answer option C sub-center. Question number 87. Endemic disease means that a disease, option A occurs clearly in a excess of normal expectancy, option B in constantly present in a given population group, option C exhibits seasonal pattern, option D is prevalent among animal. Answer option B is constantly present in a given population group. Question number 88. Live attenuated vaccine is option A COVID-19, option B typhoid, option C IPV, option D OPV. Answer option D OPV. Question number 89. Hansen's disease is also known as option leprosy, option B filaria, option C yellow fever, option D plague. Answer option A leprosy. Question number 90. Which is the most peripheral public health center where safe blood service are envisaged under Indian public health standard? Option A PHC, option B CHC, option C sub-district hospital, option D district hospital. Answer option B CHC. Question number 91. Which of the following scheme provide cash assistance? Option A জননী শিশু সুরক্ষা যোজনা, option B রাষ্ট্রীয় কিশোর স্বাস্থ্য কার্যক্রম, option C জননী সুরক্ষা যোজনা, option D রাষ্ট্রীয় বাল স্বাস্থ্য কার্যক্রম. Answer option C জননী সুরক্ষা যোজনা. Question number 92. The emergency contraceptive pill should be used within a maximum period of option A 24 hours, option B 48 hours, option C 72 hours, option D 96 hours. Answer option C 72 hours. Question number 93. Vitamin K given to a newborn weighing 900 gram is option A 0.5 mg, option B 1.5 mg, option C 1 mg, option D 2 mg. Answer option A 0.5 mg. Question number 94. The hormone responsible for milk ejection is option A oxytocin, option B estrogen, option C progesterone, option D prolactin. Answer option A oxytocin. Question number 95. Patent ductus arteriosus is an abnormal communication between the option A pulmonary artery and pulmonary veins, option B pulmonary artery and aorta, option C pulmonary vein and aorta, option D pulmonary vein and coronary artery. Answer option B pulmonary artery and aorta. Question number 96. The red color inverted triangle at the center of the under 5 logo represent option A care in illness, option B immunization, option C early diagnosis, option D family planning. Answer option D family planning. Question number 97. Flag sign is a sign in which of the following nutritional disorder? Option A marasmus, option B kwashiorkor, option C underweight, option D nutritional dwarfism. Answer option B kwashiorkor. Question number 98. As per national immunization schedule, at which age OPV booster to be given? Option A at 14 to 16 weeks of age, option B at 10 to 12 month of age, option C at 12 to 15 month of age, option D at 16 to 24 month of age. Answer option D at 16 to 24 months of age. Question number 99. A 2 years child having respiratory rate 50 breath per minute with cough and cold, at which classification of pneumonia the child belongs to? Option A no pneumonia, option B pneumonia, option C severe pneumonia, option D very severe pneumonia. Answer option B pneumonia. Question number 100. Pelvic harness brace is most commonly used for option A knee deformity, option B finger deformity, option C congenital dislocation of hip, option D spinal deformity. Answer option C congenital dislocation of hip. অসংখ্য ধন্যবাদ জানাই এতক্ষণ সঙ্গে থাকার জন্য। ভিডিওটি ভালো লাগলে লাইক শেয়ার করে দেবেন। কোনো কিছু জানার থাকলে আপনারা আমাকে কমেন্ট বক্সে জানাতে পারেন। নার্সিং রিলেটেড এরকম আরও ইনফরমেশন পেতে, নার্সিং রিলেটেড বিভিন্ন কোশ্চেন অ্যান্সারের প্রিপারেশনের জন্য ভিডিও পেতে পারলে আমার চ্যানেলটিকে সাবস্ক্রাইব করে রাখুন। আজকের জন্য এই পর্যন্ত, আবার দেখা হবে নতুন একটি বিষয় নিয়ে। সবাই ভালো থাকবেন, সুস্থ থাকবেন।